No, I'm hitting record.
I hit record first.
Okay, fine, but I hit it right after you.
I'm starting. This episode of Healing Together is brought to you by Let's Get Checked, the leading provider of at-home health tests. Want to better understand your hormone levels? With Let's Get Checked, you can do a simple at-home health test that will give you a complete picture of your hormonal health in 5 days.
Hey, Nicholas, did you know that hormone imbalances can be indicated by common symptoms like fatigue, insomnia, weight gain, headaches, breast tenderness, or changes in blood pressure? And hormones are an important factor in a number of conditions, including polycystic ovary syndrome,
Ooh, that doesn't sound good.
low ovarian reserve or ovarian failure,
I haven't had those.
and menopause or early menopause.
Ooh, I think I'm getting close to that.
No, you're definitely not getting that. But look, hormone levels can also be implicated in thyroid issues, and those can affect both women and men.
All right, so tell me, Deirdre, how does it work?
Your test is delivered straight to your door. You just self-collect a blood sample from the tip of your finger
Ouch.
and mail it back with a prepaid label. You'll receive support and guidance from the Let's Get Checked medical team, who are available 24/7 to offer you personalized advice.
I'm feeling kind of left out of this ad. But for you people who aren't, this week, you can try an at-home test for 30% off using the discount code TOGETHER30. So go to letsgetchecked.com and enter TOGETHER30, all one word.
Let's get checked. It's good to know.
All right, what do you think? How do we do?
I think we did okay.
Can we start the podcast now?
Yeah, hit it.
Welcome to Healing Together. I'm Nicholas Boileau. My guest today, Chelynn Tetreault, is an Ayurvedic doctor whose practice includes health counseling for both physical and spiritual healing. In this conversation, Chelynn and I delve into the complex subject of gut health from the very end of the process, what we eliminate and how. We talk about the significance of frequency, consistency, color, odor, and what different types of bowel movements might indicate about our health. I hope you enjoy this short conversation as much as I did. So without further delay, I bring you Chelynn Tetreault. Well, I'm here with Chelynn Tetreault. Welcome. And for those who don't know you, even though you've been on the podcast before, can we start with a quick reintroduction? Maybe who you are and what you do.
Sure. So I'm a doctor of Ayurvedic medicine, and Ayurveda is a traditional science that originated from India. And it's a very nature-based science in that there is an understanding that people are a direct influence and are influenced by the natural world and everything around us. We're all connected. And I also am a licensed massage therapist, an educator and mentor. I oversee clinical internship students at the California College of Ayurveda, which is great. That just keeps me kind of in touch with how the students are doing in our field. And I have a retreat center in Worthington, Massachusetts, where patients will fly in from all over and receive a specific set of therapies over a period of time.
Well, last time we spoke, you mentioned healthy poop versus unhealthy poop. And
That's right.
Even when you said, well, yeah, and I think it was just a passing mention, you said poop should have the shape and consistency of a banana. And I immediately was going to ask, is that a peeled banana or a whole banana? And later I kept thinking, here's something we do every day, but we don't talk about. And yet, according to you, and I'm sure you're not the only one, it can be a real indicator of how we're doing.
Mm-hmm.
So there's more and more information out there about gut health and all sorts of sales efforts aimed at people who are concerned about their gut health.
Right.
So I thought, let's have an episode. Let's talk about it.
Yes.
When you're doing your once a day, twice a day, or 5 times a day ritual, what are some of the signs that things maybe aren't quite as they should be?
Well, yeah, just going back to our subject of poop, that's actually in Ayurvedic medicine, that is one thing that practitioners will assess is we have lengthy conversations with our patients about their elimination patterns because it really can reflect a lot. So just the fact that you're asking, 1 time, 2 times, 5 times a day, that's one thing that we look at. So if a person is eliminating 5 times a day, that is an indication of a deeper kind of imbalance that we need to address and that we can address. When we think about elimination, it's kind of like a snapshot of what has occurred beforehand within the person's digestive system. So if there's something that is amiss in the person's digestive system, that means that they're not receiving proper nutrition from their food, for example. So it's very fundamental to health. And there's so many different things that can happen with elimination with someone's poop that can really provide a lot of information to the practitioner.
So other than frequency, what are some of those things we should be looking for?
So like you mentioned right in the beginning, when we talked about the consistency and shape of a banana, and it's a peeled banana, by the way. So it would be the consistency. So if someone has very, very loose poop, that's an indication that there might be what we would consider excess heat in the body, because one way that our body regulates body temperature, is actually through our stool. If you have too much heat in your body, like if someone has a fever, for example, they will often have loose stool as a way to eliminate excess heat. Loose stool can also indicate someone's state of mind, their emotional state. If you've ever been in a situation where you're very anxious, where you're maybe about to give a speech or perform, it can throw off your elimination, your digestion and elimination, and you may evacuate your bowels really quickly and create loose stool. If sometimes someone will have what we call rabbit pellets, so those really small, round, hard stool, that can indicate, obviously that's a sign of constipation. So that could be anything from like a person is simply not taking in enough hydration, or they're not exercising enough, not taking in enough foods that have healthy fiber in them, something like that. So those are like some examples. Another thing that we look for is actually the color. Normal color is closer to a little bit darker than cardboard, so like a medium brown color. But people have all different color stool, and so we take a look at that as well, and that can indicate different things.
I was recently looking up some liver problems, and one of the symptoms that they talked about online was a very light colored stool.
Yes, clay colored stool. That's because if there's something happening with the liver, like fatty liver or excess inflammation or some kind of a blockage in one of the ducts, that means the bile, which is excreted by the liver, is not being excreted properly. And so that will change the color of the stool. So even though something's happening way up near your rib cage where the liver is, even though there's a problem happening way up there, it will show up in the stool. So that is correct. Yeah, light colored stool can be an indicator.
My sense is a lot of people just get used to having, not the ideal toilet experience. There's an expression called irritable bowel syndrome, IBS,
right. Yes.
Which is this sort of blanket term that covers all sorts of conditions. But then people get used to it and they go on with their lives. Is this something you can really change, or do you just, it's a 5-minute experience. You just say, deal with it and move on.
Well, that's a good point. Maybe for some people, it's not a 5-minute experience, right? So if you're constipated, you might be finding yourself sitting on the toilet for a very long time. Also, like there can be discomfort that you experienced before. So, you bringing up irritable bowel syndrome, people usually experience cramping, bloating, gas before they eliminate. So it's really not about the 5 minutes. There's a lot surrounding that experience that can cause discomfort.
So you're saying maybe a 45-minute experience is not normal?
Exactly.
Or good?
It's not normal to be having to sit on the toilet for a long period of time, nor is it normal to eliminate and then feel like, oh, I don't feel like I've finished, like incomplete passing of stool. That's another experience that a lot of people have. So that can indicate lack of tone in the colon, that kind of thing.
What does lack of tone mean?
So our intestines, they will contract. They have musculature to them. And so they will, in wave-like patterns, they contract. That's how they move. The small intestine moves food through, and then the large intestine will move the digested food and now forming into feces through the colon. That's how it moves down so you can eliminate. And so if that tone in the musculature is weak, tone just means like the strength. If that's weakened, then you can have a problem eliminating.
Are there certain foods that are particularly good at either helping you eliminate more easily, or others that are particularly good at solidifying things up?
Yeah, really, that's a good point. It does depend what's going on for you. So if you have loose stool, so not well-formed stool, first it's important for the practitioner to find out, okay, is this from the mind? Is this from anxiety, emotions, or is it something more physiological, like I said before, excess heat in the body? So if a person, let's just say, has excess heat from something they're eating in their diet, like they could have a tendency to eat a lot of chili pepper, spicy foods that are hot, spicy, really attached to those kind of foods, that will lend itself to the loose stool. So I would work with that patient to bring in foods that have more of a cooling effect. So, I mean, some examples would be certain vegetables like cucumber that has a cooling effect to it. Some greens that have the bitter taste like broccoli rabe or bok choy or asparagus. So making changes to the diet can really help. And then if it's something more mind-based, so like anxiety that's creating looser stool because the peristalsis, the movement of the colon, is happening too fast, then we work with things like breath work to help to calm the mind, which then in effect calms the body and the digestive system.
So it's not just the foods that you might be quote unquote allergic to. It's also what's going on emotionally and maybe mentally during or psychologically during a particular time in your life.
Yeah, absolutely. I mean, sometimes a person will have a true allergy, but that's often not the case. So it's often other factors. It could be how they're eating their food. So the habits around how you eat, what time of day or night you're eating, what kind of food. Yeah. And then, of course, also what's happening in your surroundings and your state of mind.
Would you say there's some most common bowel problems that people struggle with? And are there things you can do that are easily accessible to most people?
Yeah. Let's take constipation, because that's just so terribly uncomfortable for people. And so some simple things to start with is to make sure that you are getting in proper hydration. So that means drinking fluids that are not caffeinated, because caffeine, unfortunately, coffee, green tea, soda, a lot of sodas, will dehydrate the body. They're a diuretic, which means it causes you to urinate and lose fluids. And so what you have to do is, this is a very, very general rule. Learn what your body weight is. You divide that in half, and that's generally about the amount of fluids that you should be taking in per day in ounces. So let's say someone is 150 pounds. Oh, now I have to do the math. Let's say someone is 160 pounds, because I can divide that easier. That means that they should be drinking about 80 ounces of non-caffeinated fluids a day. And so that's basically filling up a thermos, so you can keep track of how many ounces you have, let's say, sip that throughout the day. So proper hydration is a really basic way to help avoid the tendency for constipation. Another thing is to really reduce the amount of refined flours that you eat, which means like crackers and non-whole grain breads, and including more cooked vegetables. Cooked fruits can also be really helpful as well. So more fresh vegetables and fruits in your diet.
Are there certain oils that are better or worse?
Yeah, absolutely. Oil, the quality and kind of oil that a person eats really makes a difference. Again, as a general rule, I really only recommend olive oil. So organic, if you can, cold pressed, unrefined olive oil, or what we call ghee, which is clarified butter. Those are really good choices for oils. Unfortunately, a lot of the seed oils like sunflower seed oil, safflower, canola oil, those oils are very unstable, and they actually they have a tendency to create inflammation really easily in the fat tissue of our bodies. And so taking in the correct oil, so olive oil, ghee, those are great starts right there. And making sure that you have a good quantity of oils. So average person should have, and again, please keep in mind, this is generally speaking, about 3 tablespoons a day of oil, which may sound like a lot, but you can use those oils a lot in your cooking and then also to then put on top of your foods. So it's important to have proper oils. That's how we keep our colon lubricated and help prevent constipation.
What if you have a chronic problem and you never address it? Are there long-term issues that your body could be warning you about every time you're on the toilet, and then ignoring them could lead to bigger or more troublesome problems?
Yes, there's absolutely a potential for that. In Ayurvedic medicine, we definitely view digestion and elimination as one of the foundations of health. So if things start to go wrong in those systems over time, it will create imbalance in the deeper systems of the body and the deeper tissues like our joints and bones and our muscles. So for loose stool, if a person has that over a period of time, that can indicate and also create a tendency for ulceration in the colon, which means like sort of like little wounds that are forming inside of the colon, inflammation in the colon because the colon's trying to heal and repair itself. So there's a lot of heat coming in. That creates more ulceration, and eventually that can lead to something more serious, potentially like a type of cancer.
So that's a sign of inflammation, chronic inflammation.
If you have loose burning stools, that's an indication that you could have a lot of inflammation in your colon. Yes.
What about wiping? Should you strive for the wipeless movements?
Yeah. If you are seeing a lot of stool on your toilet paper, it's an indication that you're not voiding completely. And also, like you just said, it's an indication your stool might be kind of loose. So you need to either eat cooler foods or work with your mind and emotions, creating a more calm environment for yourself. So yeah, it could be a sign of incomplete.
What's an example of a cooler food?
Cucumbers, vegetables that have a bitter taste to them, which I can give you some examples like asparagus, broccoli rabe, mustard greens, dandelion greens, which not a lot of people eat. The bitter taste is something that we don't have a lot in our culture, in our diet, but it's something that is really helpful for nourishing the liver. That bitter taste really gets our liver moving. So I would recommend that as a start. Cilantro is another, that's a spice and herb that you can use that's cooling.
Okay, so I have to ask, what about odor?
Mm-hmm.
Do you ask your patients about odor, and do you have conclusions based on odor?
Yeah, if there's a really strong odor, that can indicate a little bit of an imbalance in the gut flora, meaning the microbiome in the gut. So you really shouldn't have too strong of an offensive odor. Now it's funny, I think like in our culture, some people are almost proud, especially the dads and brothers out there.
Proud to destroy the bathroom for a few hours?
Yes, or just like, be in the room with you and let one loose, but it's actually an indication that there's a little bit of an imbalance in the gut flora. If there's odor, there should not be a strong odor.
Yeah, that makes sense to me. I know when my dog eats, a dead animal or some other creature's poop, or even has gotten in the dog food and crazily overeaten, It can be pretty toxic around her after a while.
Oh, absolutely. Yeah. So the bacteria in our gut will give a little bit of a sulfuric smell to our gas, and that's within the realm of normal. It just shouldn't be incredibly offensive.
Do you have time for a few rapid fire questions?
Yeah, sure.
Okay, let's make it a game. I'll say the thing,
Okay.
and you say good, bad, and why.
I'll do my best. Okay.
Okay. Explosive.
Well, that's bad. Yes. That can indicate, possible food poisoning. It can indicate a major imbalance with your gut flora, for example.
Sandpaper gravel.
I've never heard of that before. Sandpaper gravel? I'm going to have to take a pass on that one because I've never heard of that.
Large rocks.
Okay, well, that's an indication of like impacted stool. So, very low fiber diet or a colon that is not responding at all. And so that's not good at all. And that can create, very extreme, that can create a lax colon that loses all of its tone.
So large rocks is sort of a see your doctor condition.
Or Ayurvedic practitioner.
Okay.
Yeah, because you can have some impacted stool. So we have some recommendations that we can give to people that are at that point.
But basically deal with it.
Oh, yes, absolutely deal with it. Mm-hmm.
Garden hose spray.
That sort of is reminiscent of your explosive.
That's true, but it could be just turn on the faucet, right?
Oh, yeah. Okay. All right. Yeah. So very loose, watery stool, again, can indicate some kind of a pathogen, so some kind of infection. Or if you do have loose stool, garden hose spray style, that could indicate an allergy as well.
Okay, soda can. And I say this because I've had kids in my life, and it's remarkable how those small bodies can create something that just won't flush. And is enormous.
I see.
Enormous and hard and needs to be broken up.
Right.
And I've always wondered, how can that little body create that giant thing that I have to deal with? And is there a health problem there?
Right. So if it's happening occasionally, and particularly during a growth spurt for a child, it could just be that their digestion has slowed down a bit because they're going through a growth spurt and they're really trying to take in as much nutrients as they can. So that would create larger stool. As long as they're having enough fiber, fresh fruits and vegetables, it's probably, and they're not feeling any pain, then that is less of a concern, particularly if it only happens occasionally. If it's happening all the time, then that might not be such a good thing. And that would require further evaluation.
Toothpaste?
So when I think of toothpaste, I think of like kind of pencil thin size. If we're on the same page there, is that right?
Yeah,
kind
and
of like a smaller,
and not well formed.
Yeah, so really soft, and so that is not good because that indicates that there's inflammation in your colon. So it's creating like a smaller sized stool.
So make sure to address that.
Mm-hmm.
And finally, what's with corn?
Yeah, corn is really hard for our body to digest. And it's a grain. It's just the casing on the corn. So it's very hard for our body to break down. So that's not as much of a concern. One thing that might be helpful is to simply, when you're first eating corn, is to just take more time chewing. But that it's less of a concern if you do see corn in your stool. So that's not so bad.
What about beets? Are beets just giving you their color, or are they making you bleed?
Yeah, I know. They're not making you bleed. No. So that's not a concern because that's the nature of that type of vegetable.
Well, great. This has been really informative and fun. And I'm just wondering if there's anything else I should have asked you that you'd want to mention about the great and vast subject of poop.
We're going to have a poop part 2 discussion, or maybe have people type in questions or something like that. That might be fun.
Yeah, absolutely. People can send questions and then we'll do another part.
Great.
Thanks, Chelynn, and I hope we'll get to talk to you soon.
Thank you so much, Nicholas.
Healing Together is produced by Healthenly. Our theme song, Ramble, is composed and performed by Ed Morneau.